Hi, I'm Eric Wilkinson. I'm one of the physicians at the House Clinic. At the end of my fellowship, I was offered a position at the House Clinic, and that's something that I had never anticipated, but when it was offered to me, it was really too good to pass up. I mean, practicing medicine at the House Clinic is really a dream come true for me. House Clinic has traditionally been on the cutting edge of audiological and otologic research, and a lot of that is involved with medical devices. The auditory brainstem implant was developed at the House Ear Institute and the House Clinic, and over 300 adult patients have been implanted with auditory brainstem implants at the House Clinic. We're always trying to learn new ways of doing surgery. I think when you stop trying to innovate and when you stop trying to learn, I think you stagnate. I think you become somewhat complacent. So as an educational institution, we're always trying to challenge ourselves to push the limit. When patients come to see us, it's often because things that have been done thus far may have not been successful. Maybe they've not found the answer to their problem. And so we have to constantly step outside of what we think is conventional. We have the experience of what we call a high volume center, where we're seeing many patients with many ear problems and skull-based problems. Acoustic neuroma patients. We treat more acoustic neuromas than I think anyone in the United States. So patients seek us out because of our numerical experience, our experience with volumes of patients, but they seek us out also because of our personal care. I love helping people hear better. I love helping people have less ear infections. I love having people come up to me and say, I'm so happy I had that operation because now I don't have dizziness anymore. I don't have problems with my face anymore. My face is normal. I don't have problems with, with my hearing. I don't have problems with being able to understand people. You did a cochlear implant. Now I can actually talk on the telephone again. So these are all things that I'm really happy to be able to provide patients, because for me that's what it's all about. It's about that relationship that you have with your patient. And we try to care for patients like we would care for our family members. And I'm constantly finding myself when I speak to patients saying, if you were a member of my family, this is what I would recommend for you. I think that outcomes are great. You can put numbers on a sheet of paper and show people what the outcomes are, and our outcomes are outstanding, are I think superior. But until people make that connection with their doctor, they make that personal connection and know that their doctor cares for them, that will then allow them to make a decision to seek care at House Clinic. And I think we have everything that it takes to provide a patient with the best outcome, with the most personalized care that they can obtain anywhere. I got into medicine because I love taking care of patients, and my relationships with my patients are very dear to me. There's nothing better to me when a patient who I've known for several years comes in, and it's like seeing friends. We're friends, and we see each other. We usually talk about a lot of stuff outside of medicine and what's going on, and those kind of relationships are very long-lasting, and I really enjoy making long-lasting relationships with my patients. Most of my patients, especially patients I've ever operated on, those are patients who are like family to me. For patients that are considering coming from out of the state or out of the country for care at House Clinic, I would say come see us in LA, because I think you'll have a good experience. Plus, Los Angeles is beautiful. Come experience Los Angeles and not only have your medical treatment, but also have some fun while you're here. So to patients that are wondering, I would tell them, don't hesitate to come to House Clinic, because I think we can provide the best outcome they can possibly hope for.